Hi, my name is student Dr. Ryan O'Neill.
And I'm student Dr. Dylan Roper.
Today we will be demonstrating how to identify cardiac structures using the CAE Vimidex ultrasound simulator and a curved cavity probe. We'll be identifying cardiac structures from three separate views: the subxiphoid view, the parasternal long axis view, and the parasternal short axis view. We will identify different anatomical landmarks in relation to the cardiac chambers and valves of the heart. First, we will demonstrate the subxiphoid view. We'll begin by palpating the sternum and moving inferiorly until we reach the xiphoid process. Once the xiphoid process is reached, we will take the probe and place it inferiorly to it, with the indicator pointed to the patient's right. Here, we can visualize multiple structures. We have the liver, the stomach. This white hyperechoic line indicates the diaphragm, and we have the descending aorta. It is important to recognize and visualize these structures because this is how we know we are in the correct orientation. Next, we will rotate the probe to the right until the probe is perpendicular to the axis of the left shoulder. Next, we will tilt the probe caudally until the atria are viewed. Here, we have the left atrium and the right atrium. We know this is the right atrium because the indicator is pointed to the patient's right. Here, we can also see the tricuspid valve. This is important because it indicates flow from the right atrium to the right ventricle. We will continue to tilt caudally until we now visualize the left atrium and the left ventricle. The valve in between these two chambers is the mitral valve. You will also recognize the aortic valve, which will allow blood to flow from the left ventricle throughout the aorta. The left chamber and ventricles are important because the left side of the heart is more susceptible to pathologies due to the high pressure system. We will continue to tilt caudally until we visualize the pulmonary valve. The pulmonary valve will be indicated because blood will be pumping from the right ventricle through the pulmonary veins. The heart can be examined in high resolution using the subxiphoid view on the ultrasound simulator. However, the subxiphoid view in real ultrasound has limitations due to the amount of tissue the sound waves must pass through while examining the deeper structures. Hence, the more common view through which the heart is examined is the parasternal window. Next, student Dr. Dylan Roper will demonstrate the parasternal views to examine the cardiac structures.
Hi, I'm student Dr. Dylan Roper, and I will be demonstrating the long and short axis parasternal view. The first thing we will do is palpate our patient's left clavicle and find the midclavicular line. We will then drop down to about the 3rd to 5th intercostal space. We will call this the parasternal window. From here, we will take our probe and place it at that intercostal space. This may vary from patient to patient. Depending on your patient, you may have to move it to the 3rd, 4th, or 5th intercostal space. Once you place the probe at the intercostal space, place it transversely. Next, rotate the probe until the indicator on the probe is pointing towards the patient's right shoulder. From here, we can see the heart. Here we're looking at the left atrium, the left ventricle, the aortic valve, the mitral valve, the septum of the heart, as well as the right side of the heart. The reason we know that this is the right side of the heart is because our indicator is pointing towards the patient's right shoulder, and the indicator here on the screen is closest towards the right side. Therefore, the right side of the heart corresponds to this location. From this view, we can tilt the end of the probe cranially to view the right side of the heart. Here we can see the right atrium, as well as the right ventricle and the tricuspid valve. If we tilt the probe caudally, the left side of the heart comes back into view. From this view, we can transition to the short axis parasternal view, by rotating the probe until the indicator is pointed towards the patient's left shoulder. If we tilt the probe caudally, we can see the left atrium and the left ventricle as well as the mitral valve. As we continue to tilt the probe caudally, the aortic valve comes into view. If we tilt the probe back cranially until the mitral valve comes back into view, if we roll the probe towards the patient's left shoulder, we can see the tricuspid valve as well as the right atrium and the right ventricle.
This concludes our demonstration on how to identify cardiac structures using the CAE Vimidex ultrasound simulator. We hope this video was educational and informative, and we would also like to thank you for your time.